Hello, my name is Marisa Mercer. I'm an FNP student at the University of Texas at El Paso. I am going to be doing an abdominal assessment today on my patient Chris here. So first of all, with an abdominal assessment, you're going to start off with the patient's general appearance when they come into the room. Does it look like they're in any kind of distress? Are they doubled over, holding onto their stomach in pain? Are they breathing okay? We're looking at the color of their skin, mental status. Are they confused? Are they alert and oriented? Are they able to talk in complete sentences? Chris here is not in any distress. He looks completely normal, breathing normal, skin color looks good. Now, when we inspect the abdomen, we want to go in a certain sequence because if you were to percuss or if you were to palpate, that would stimulate peristalsis and you would have increased bowel sounds, which would not be an accurate reading. So first we start off with inspection. Looking at the contour of the stomach, looking for symmetry, looking for any bulging masses, any umbilical hernias or hernias in any other locations, looking for any striae, the color of his skin, excessive hair, looking for any kind of peristaltic waves or abnormal pulsations. Next, once we've inspected, which I inspect his abdomen to be completely normal, just slightly protuberant. I see a normal distribution of hair here. I see some moles here, but every one of those looks normal with normal margins. So I'm gonna have a listen to him, and I'm gonna be listening in each abdominal quadrant. Okay, there's 4 kind of crossed by the umbilicus here, starting in the right lower quadrant to the right upper and going clockwise. And then after listening in each quadrant, I'm also going to be listening to the abdominal aorta, listening to the renal arteries, the iliac arteries, and if I needed to, I could listen to the femoral arteries as well, but I won't do that here in this video. Also making sure that the patient is comfortable. Chris, are you comfortable?
Yes.
Are you cold? Do you have any pain or tenderness?
No.
Any areas in your abdomen that are sensitive or tender?
No.
So if he were to say yes, there are areas of tenderness or pain, we would do those areas last. So that would kind of guide my assessment. So I'm gonna have a listen here with the diaphragm and my stethoscope for bowel sounds. I'm listening for normal active, which is about 5 to 30 bowel sounds per minute. And then absent bowel sounds would be the absence of any bowel sounds for a full 5 minutes. And then there would be hyperactive and hypoactive. Have a listen here. You can just breathe normal. So bowel sounds are normal active for Chris here. I'm gonna switch over to the bell of my stethoscope and I'm gonna listen to the aorta, to the renal arteries and the iliac arteries. I'm gonna skip the femoral for now, just for his privacy. Listening for any breweries. Also note any kind of abnormal pulsations. So everything sounds normal. I don't note any breweries in any of the arteries that I auscultated here. Next, I'm gonna percuss his abdomen, and what I'm listening for is tympany. I should be hearing tympany, but there may be some areas of dullness, or there may be some areas of resonance, like here in the left upper quadrant, there may be a little resonance from the bubble within the stomach, or it could be dull if he has a full stomach. If he were, for example, to have fluid in his abdomen or peritonitis, I might notice some guarding or tenderness there when I would percuss, or I might notice a fluid shift, or I might notice dullness on percussion. So I'm gonna percuss here in each quadrant starting from the same direction, the right lower quadrant first. I might notice some dullness here from the liver, but we'll come back to that in a minute. Sign up tympany in all quadrants, and I don't know any areas of dullness except for right here in this lower costal margin on the right side. I can palpate some dullness there from the liver. So next I'm going to palpate lightly, again going from the right lower quadrant, upper, and then across. I'm going to be going little circles lightly. Let me know if that hurts, if there's any pain. Feeling for any masses, feeling for any fluid shifts, any tenderness. Noticing particularly when I remove my hand, if there's any kind of rebound tenderness. Now with light palpation there may not be much rebound tenderness, but once we get to deeper palpation, I might note that. So his abdomen feels just fine. I don't notice any masses. I don't notice any tenderness or guarding or any rebound tenderness when I palpate. So I want to do a deeper palpation now, going in all 4 quadrants. And again, this is kind of feeling even deeper for masses, particularly in the organs that are deeper in back there, like the kidneys, for example. If you can palpate the kidneys, then they're most likely enlarged, or there could be a mass on the kidneys. Also, if the spleen is enlarged, it enlarges in this direction toward the umbilicus. And then if the liver were enlarged, it would enlarge this way. So I would be able to feel those edges possibly, or at least a more solid organ. So I'm going to do deeper palpation with 2 hands here. Just try to relax your stomach, okay? Normally I would have the patient's knees bent a little here to kind of help with relax your stomach. There we go. Deep palpation. Just try to take a deep breath. Does that hurt? Just try to relax. Okay. So I don't note any masses there. He is a little bit tender on this side, but that could also be just because I'm pushing down a little deep there. The next thing I'd like to do is to estimate the size of the liver. Normal for the liver would be around 6 to 12 centimeters in the midclavicular line here, and then in the midsternal line would be about 4 centimeters max. Now if I'm starting to feel dullness further down, I would try to estimate where, doing percussion here, but imaging would be the best for a diagnosis there. So I'm going to start here at the midclavicular line and come down to about the umbilicus and work my way up, percussing from tympani to dullness. I'm noticing dullness there. Now I might hear resonance the further up I go towards the lungs. Notice dullness from here. Dullness there. So I'm palpating or percussing dullness in this area right here, right? And probably about 1 centimeter below the costal margin, but I'm gonna try to palpate for that as well. I can do this whenever he is taking a deep breath in and having my hands this way, one on top of the other, right underneath the midclavicular line and the right costal border, or costal margin. And I want you to take a deep breath in for me. Let it out, all the way. Go, 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 go. All right, I'll take another deep breath in. As he breathes in, the diaphragm will push the liver down right into my fingers here. And I can feel it just about 1 centimeter below the right costal margin. So the next thing I'd like to do is palpate for the spleen. The spleen is over here on this side and the right side, kind of around the 6th and 7th intercostal margin or intercostal space. If it were to be enlarged, it would enlarge this way again, and I could possibly palpate and get an estimate on its size. Now, most of the time that's not diagnostic. Imaging would be the best way to diagnose splenomegaly, but we can still assess trough space. So I would be going from the anterior axillary line right here down to the lower costal margin on the left side, and then finding the 5th intercostal space right about here. And this triangle that it makes right here between the costal margin, the left costal margin, the bottom of the ribs here, and this 5th intercostal space kind of gives us an area to percuss for the spleen. We're trying to percuss for dullness typically, If you're gonna feel or percuss the spleen, you might feel it around the 6th or 7th intercostal space. If you're feeling it below that, then you wanna start to work your way this way to try to anticipate where it's enlarged. So we're gonna try to percuss here in 12 space. Can go up a little bit further and try to listen for that change from resonance to dullness. So I can hear a little dullness here around the 6th intercostal space. I'm going to keep going to see if that dullness continues. Here I can hear resonance, most likely from the bubble in his stomach. So I don't notice any enlargement there, but another thing I'd like to try to feel is also the border of the spleen as well. So I can have him turn over to the right lateral recumbent, over this way. And it would be best to be on the other side of him, but I'm trying to do this and still be in the video here so you can see me. So I can percuss some more on this side. And then I'm gonna feel here for the costal margin, the left costal margin, and I can do a hook method and have him breathe in all the way. Breathe out. Just kind of hook here. Now take another deep breath. And I don't feel his spleen, which is normal. If I were to feel his spleen, that could be suggestive of splenomegaly. I could also do a similar way. You can lay back on your back, as I did the liver, and I could have my hands here underneath the left intercostal margin, or the left costal margin, and have him again take a deep breath. Let it all the way out. Just try to dig underneath there and take another deep breath. And if it were enlarged, I might be able to feel that tip. That takes a lot of practice to be able to feel that, but for him, I don't feel anything. It feels completely normal, not enlarged. The next thing I'd like to look at is the kidneys and the urinary bladder. So I'm gonna feel, did you potty before you lay down? Okay, so he already went potty, his bladder should be empty. If it were full, I might percuss some dullness there. So I'm gonna feel right here. Any tenderness there? All right, again, just tympani. Tenderness there?
Yeah.
Okay, all right. So I don't notice any enlargement of his bladder. What I'm gonna check now is, and really just a little bit of slight tenderness, but that could be because he's not completely emptied his bladder or just pushing too hard. All right, can you sit up for me? I'm gonna have your back to the camera here. Next, I'm gonna check for costovertebral angle tenderness. This can be indicative of pyelonephritis or pyelonephritis. I'm gonna put my hand here right about the left kidney, and I'm gonna take my fist here and just kind of lightly tap. And if he were to have pyelonephritis or inflammation there, he would have some tenderness. Any tenderness? No. I'm gonna do the same thing here on the right side. Any tenderness? All right. And that is it for the abdomen. Thank you for watching. Have a good day.